welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you for joining us. For Your Health is a program that looks at various health issues, health concerns, and helps you to stay healthy and, of course, informed. Joining me today from the City of Quincy Public Health Department, she is the Public Health Coordinator, as a matter of fact. That would be Caitlin Pico. Caitlin, welcome.
Thank you for having me, as always. Happy to be here.
Great to have you. A lot of information is shared through this show to the residents of Quincy, but beyond. You actually have gone, this show has gone throughout Massachusetts and to other states. Yes,
which is amazing. And as always, I always just like to go from the CDC and the State Health Department information, so it is as universal as possible information. So very exciting that it spread so far.
Very good. It's it doesn't amaze me because I know these programs are very informative. There's a lot of great information. It's just nice to know that other communities are picking this up.
Yes, yes.
This topic today is all over the news. Just this morning, I heard a story about it. That is monkeypox.
Yeah, so of course this is now another after COVID. We were hoping we wouldn't see another one, but now we have monkeypox. So coming on here today, we would, as always, go through symptoms to look for and how you could prevent illness in yourself and your loved ones.
We have that outlined, so we will look at that. So you at home will know what to expect on today's program. We will start by definition. So what is monkeypox? We will look at signs and symptoms, modes of transmission, the incubation period and infectious period, the individuals at high risk, what to do if you're sick, and lastly, we will look at prevention. So what is monkeypox? And we should mention that even though it's new to me, when this broke, I'm like, monkeypox, I've never heard of it. It actually goes back to 1954.
Yeah, so it's actually 1958. So it was, the reason it's called monkeypox, back in 1958, it was first discovered in a lab in a monkey. But the natural host is actually rodents for this virus. But this is a zoonotic disease, meaning it can be spread between humans and animals. And it is caused, of course, by the monkeypox virus, which is from the family of orthopox virus, which also includes smallpox, vacina virus, which is a virus that is in the smallpox vaccine, and also cowpox.
Which is another disease which I knew nothing of. I didn't know that that existed either.
Yes.
Cowpox.
Yes, and I've only been in my position for 4 years now, but I have not come across that, and I'm hoping I will not. But
well,
it would be.
With that said, we won't have to do a show on cowpox.
Yes,
hopefully.
Let's hope not. Let's hope not.
We're going to look at signs and symptoms now, and folks, of course, again, because it's in the news, will hear a lot about the first one, and that is a rash.
Yeah, so most commonly, the biggest one that we see is the rash. It's important to know with these clinical symptoms, individuals may not have every single symptom, and they're still trying to do research to see if people potentially could be asymptomatic. But at this point, you're only considered infectious if you have the actual rash. But clinical symptoms of monkeypox include a rash, fever, chills, swollen lymph nodes, fatigue, muscle aches and back pain, headache and respiratory symptoms, which could include a sore throat, nasal congestion, or cough. And it's important to know that this rash typically occurs within 3 days of the fever onset. Again, you might not always get that fever. And we do have 3 images of these different, what it may look like. These lesions typically develop on an individual's genitals or anus area, but can also be found in other areas, including the hands, feet, chest, face, and mouth. And these become, it's called vesicopustular. I apologize if that's mispronounced.
That sounds good to me.
Yes, but basically what that means, it's similar to a pimple. It starts as like a clear blister, and as it evolves, it will get a little bit more cloudy within the blister. And then eventually it will scab over and fall off.
So almost like a chicken pox.
Similar, yes, very similar. They do say it really resembles pimples though, so like just if people notice that, especially if they think they've had exposure, definitely keep an eye out. But this rash can be very itchy and painful, and it's similar to the smallpox rash, where it's like raised bumps that go through these stages, as I say, that crust over. And the duration of this illness can be 2 to 4 weeks. So individuals can be dealing with this for up to a full month, which can be very irritating.
And I would assume before they scab over, they weep.
Yeah, so they can weep, and we'll go into a little bit, like if you are sick, you want to keep these lesions dry and clean, and you definitely don't want to pop them. I know pimples, a lot of people have a tough time leaving it alone.
Right.
You would not want to do that in this case of monkeypox.
Especially like Dr. Pimple Popper.
Yes,
right on
yes,
TV.
it's not the same type of lesion, so do not do
Right.
that. Yes.
My wife watches that show. I can't get into that show
Yeah,
myself.
me neither.
Modes of transmission.
So this virus is spread through close contact. So that would be either close contact, which is skin to skin. You would have to come in contact with an individual with the rash. You would have to come in contact with their rash and then touch your own skin for it to transfer. But it is also found if they, say, bed sheets, or they have an object that touch their lesions and then you touch them, it can also transfer through those objects.
So a chair, someone sits in a chair, short sleeves, let's say, their arm touches the armrest.
Yes, it could spread that way. It's not very, at this point, the most that we're seeing is more intimate contact with these cases. So during intercourse or touching of an individual's genitals or anus area while they're infectious with monkeypox, that is where we're kind of seeing a lot of this transmission. It's more prolonged face-to-face contact. So that's why we kind of think more of like a sexual contact rather than somebody you're brushing by in the grocery store. It's very unlikely that you would get it in that grocery store setting.
And what about pregnant women?
Yeah, so they also have identified that pregnant women can spread this virus through the placenta to the fetus. And then also infected animals.
This just came up. This was, I think, in the news just a day or so ago about animals transmitting it, or actually someone that is infected maybe touching that animal then can carry it,
Yes.
and someone who touches that animal could get it.
Yes, and although it's called monkeypox, I know I mentioned this before, rodents are more the natural reservoir. So in my research, I found elephant shrew, which is like similar to like a little mouse. There are rats, squirrels, monkeys, and then of course on the news they did just discover that you can transfer it to your dogs. So it is a little alarming, and they're still doing research to see how this spreads, and they're really, the CDC and the state local boards of health are really trying to crack down and contact trace to help reduce the spread of this virus.
Now we should mention that this virus is not deadly.
So no, it is not deadly. It is it's not treatable. They treat more the symptoms, but it is preventable if you are vaccinated and you have safe practices, which we will review when we get to prevention.
Now we're looking at the incubation period and infectious period.
Yes, so right now, so the incubation period ranges from 10 to 14 days, but they say typically it's 12 days. So that's how long it takes from when you were exposed for you to develop symptoms yourself.
That's a relatively long time.
It can't, yes. And again, they do not believe when an individual is asymptomatic, they don't believe that they can spread it in that time. They believe that you have to have the rash in order to expose or be symptomatic in order to spread it to
Oh,
somebody
that's a good
else.
point. Okay.
But it's, as I said earlier, it can be, you can be contagious for up to a full month following. So you want to make sure that once you are diagnosed with monkeypox, because of course you would need either testing or a physician would have to diagnose you based on all of your symptoms and your risk history. But once you are diagnosed, you would want to make sure to isolate because you would not want to spread this to anyone else. And they really say that until this rash crusts over and new skin is healed, you're infectious until that new skin is healed.
And again, it's itchy, so you might be tempted to scratch, but don't.
Yes, you don't want to scratch because that can just spread it. And also if that's now on your fingertips, you can put it to different objects and it's just not safe. You want to make sure you're really just keeping your hands off of it and keeping it dry and clean.
You must be able to apply, if the itch is, I don't want to say unbearable, but tough to handle, you must be able to apply maybe something to it, or I'm not sure. Can
yeah,
you?
So there are, and I will get into that under what to do when you're sick, but there are different topical, like even Benadryl, oral Benadryl can help with the itch. If it is severe, unmanageable pain, that's when they tell you to contact your healthcare provider because hospitalization could be necessary to help an individual manage the pain, especially relating on where the rash is. Because of course, if it's in your genital area, that's also gonna affect using the bathroom and all of that. So it depends on the individual how severely they're gonna be feeling these symptoms.
Right, okay. All right, so next, I guess we will look at individuals at high risk.
Yeah, so although this is the whole population, the whole community should be aware of what to monitor for, they are saying right now, and this is, I keep saying they, I'm referring to the CDC and to the Massachusetts Department of Public Health. The individuals, it's into 4 categories. So the people at higher risk would be people that have been identified by public health officials as having contact with somebody who has monkeypox. We do this through contact tracing, and we work very closely. The local Board of Health works very closely with the state level, especially for this monkeypox where it is new and we're trying to get our bearings on it. But they're very quick to update those investigation tools to make sure we are trying to cut down on this transmission. So that would be the first one, if you were identified. The second one is if you are aware that a sexual partner that you've been with in the past 2 weeks has been diagnosed with monkeypox. And others at higher risk are individuals who have had multiple sexual partners in the past 2 weeks in an area that is known to have monkeypox. And then lastly, that would be individuals that may have workplace exposure. This is less likely. I don't, in my research, I have not seen that any lab workers have been exposed. So it would be somebody that works in a lab that is working with these viruses, or somebody in healthcare that is treating a patient. But of course, in the workplace, these individuals are putting all sorts of safety measures in place to make sure that they're not exposing themselves.
Right. I know I was skipping ahead, but now we're there. What to do if you're sick? And of course, this gets into the medication.
Yes, yes. So the first thing you want to do, so if you develop a new rash or an unexpected rash, what you want to do is avoid close contact with others until you're evaluated by a healthcare professional. We always say contact your primary care provider. If you do not have a primary care provider, there are public health clinics in communities that could assist individuals. For example, here in Quincy, we have Manna Community Health Center, but a lot of these public clinics are aware to look out for that. And also, what you want to do is when you go to that appointment, you want to make sure that you're wearing your mask, and also you kind of want to give the physician a heads up, just a reminder, I'm here to investigate potential monkeypox. Whether you thought you had an exposure or the rash just suddenly appeared and you're just trying to evaluate, you just want to, they're aware, of course, to look out for this right now, but just to be safe, you just want to make sure that you're saying that to the provider just before they go to like touch or assess the area.
And I might have missed this, but how long could someone have monkeypox? Did you say that you could be infected, you could be infected for a month?
So you're infectious for as however long the rash lasts.
Okay.
So they say most individuals do not need treatment. Normally they heal within 2 to 4 months.
2 to 4 months.
I apologize.
Okay, I'm
2
thinking,
to 4
well,
weeks.
okay.
That sounds a lot
Which is
better.
still a long time.
Months would be a
But
little
that's
crazy.
worse.
Okay, yes, 2 to 4 weeks would be the infectious period. So where there is no specific treatment for monkeypox, because this virus is so similar to the smallpox, drugs and vaccines that were developed to treat smallpox are now being utilized to help individuals who have severe symptoms when it comes to this monkeypox. So for example, if somebody is immunosuppressed and they get diagnosed with monkeypox, their healthcare provider may seek some of this treatment to help them. Otherwise, if it's milder and it's really just the rash, they would just kind of monitor this at home themselves. I keep saying this, but you want to make sure you're keeping that rash clean and dry. Do not pop the lesions or scratch the area. Whenever you're doing this, and it's same with acne as well, you're opening that area for infection from different bacterias. So you want to make sure you're really not scratching to reduce the spread.
Does it help to, well, I suppose it doesn't, to pat the area, but then you're touching, so that's not good.
Yes, so they say you could probably pat it dry with like a clean towel or paper towel. They did say like if you, it's kind of hard. Like if I had a rash right here and I go to touch it, like not realizing,
Right.
They just say make sure you wash your hands with soap and water, especially before eating or touching your face or other areas of your body, because you don't want to spread that. And then they also say, so the biggest thing, so you are monitor these symptoms at home, you want to make sure you are managing that itchiness, because it can be very painful when you're itchy. So they say that topical benzocaine or lidocaine gels can be used. Other topical creams such as calamine lotion can help with the itch, or oral antihistamine such as Benadryl. And that is temporarily rash relief. They also do say that you can do bath soaks in warm water, such as like an oatmeal bath. They do have the sitz baths, so if it were to be in an individual's genital areas, in that case, you want to be in close contact with your doctor because that's, of course, harder to manage. But a sitz bath, which after pregnancy, women will use that as well to help heal the area, that can be helpful to keep it dry and clean in between. So if you're in that situation, I definitely say contact a healthcare provider and they can kind of give you the steps of where you could find the medical supplies for that and everything.
And most importantly, we're going to tackle prevention. So if you can prevent getting it altogether, that's the goal.
Yes, so preventions in public health, that's what we always try to do, is prevent. So with this, you want to avoid close skin-to-skin contacts with individuals who have a rash that resembles monkeypox. If you don't know, don't touch it, of course. You also want to avoid contact with objects and materials that that individual could have been using, or utilizing prior to cleaning them. And I do apologize, I didn't look into the complete cleaning methods, but that information could definitely be found on the CDC website. They have a bunch of links, and I definitely recommend if people are trying to get more information, go there. Again, as I said, wash your hands. And lastly, which is always our favorite, is get vaccinated. So right now, the preferred vaccine for monkeypox is it's called JYNNEOS, which is a 2-dose vaccine, and it typically takes up to 14 days after getting the second dose for the maximum protection. But it's important to know, and it's all over the news right now, there is a limited stock. So as of August 8th, the state health department and their vaccine partners are prioritizing first doses to high-risk individuals because they're really trying to get at least that first dose to as many people possible. And right now, the current eligibility to get vaccinated would be if you were, again, identified by a public health official that you were exposed, or if you had a presumed contact, meaning, again, within that 2-week period, you had a sexual partner or you had multiple sexual partners in an area where there is an outbreak. You also, in this circumstance, you would need a doctor's referral to go get vaccinated. So if you believe you fit this eligibility, I would recommend reaching out to a healthcare facility, your provider, or again, that public health clinic. Because these healthcare providers would be then responsible for doing a risk assessment and exposure assessment prior to referring that individual to go get vaccinated. On the CDC website and the state website, I apologize, it must be the state website. They have all of the different areas and facilities in Massachusetts that are offering this vaccine. So locally in our area, there was like Boston Medical Center would do it. Mass General has a sexual health clinic that also offers that. But again, important to know, you need a referral. You would need an appointment, so just don't show up there.
So it's just not like getting a flu shot.
Yes, so it is because it is in high demand, and they're really trying to get it out there to individuals that are at higher risk right now. And I just wanted to mention that because it is a little bit hard to get right now, the CDC recommends different things. For example, if you are going out to, say, like, it's a lot of clubs and where people are face to face and dancing and very close skin to skin contact is where you're seeing the spread a little bit more.
Like a rave.
Yes. So they say if you're not vaccinated, limit your exposure, limit your close contact with others. If you do have a new sexual partner, if you're, of course, it's a stranger, but at least get their information, contact information. So God forbid if you or that person were to, within 2 weeks, develop symptoms, that way you can contact them and notify them. I have to say also, as a public health nurse, we work with the case, we work with the state to contact trace, so it remains confidential. Although you would think like they know who they were with, but still, if you aren't comfortable calling someone and saying, hi, I have monkeypox, that's what we're here for, and the local public health nurses would be the ones calling.
And there's no, to my knowledge, I haven't heard of any lasting effects. If someone were to get monkeypox, would they notice anything in the future that was related to it?
So I believe they're still researching. To my knowledge, I would have to look a little bit more into that to see lasting effects on an individual. But the biggest thing right now, especially, although it is kind of an isolated social group that's being impacted right now, we want to make sure that it is the people that are at high risk get the vaccine, they're being safe to reduce the spread to globally into the whole community.
Right. Now, additional information, you had referenced that a couple times during the show.
Yes, yes. I always push my resources because that's where you can find everything. The CDC website and also the state Massachusetts Health Department, their website, all of the information is so easy to access. You log right in, you could even Google CDC monkeypox, and then they have all different links for prevention, treatment, what to do if you're sick. All of this information comes directly from there.
Well, very good. Thank you for delivering this topic to me and, of course, to the viewers at home.
Yes, thank you so much for having me.
A lot of information, a lot of good information out there. So once again, thank you, and we'll have to have you back on a different day with a different topic.
Yes, and
Sound
as always, we're open to different topics, so I always tell individuals at the Kennedy Center here in Quincy when I see them, I'm like, if you have a topic that you want to see, give me a call.
Very
We
good.
can definitely research that to get the information out there.
And your number is on screen, so that would be
Yes.
617-376-1286. You heard Nurse Pico. If you have a topic that you haven't seen covered and that you would like some information on, we could certainly do that for you.
Awesome.
Great. All right. Well, till next time, thank you again for joining me.
Of course, thank you.
Thank you. And thank you at home for watching. Please continue to support your local Access television station in whatever community you reside. Take care.